Welcome, welcome. Welcome to my new system of fun, learn and earn system for dentists. So, today's topic is wounds. What exactly is a wound? So, wound is basically the disruption of the integrity of the tissue. So, that integrity may be anywhere in the body. So this is a smooth skin. If there is disruption, means there may be cut, there may be some trauma, sharp instrument or anything that can lead on to disruption of integrity of the tissue. So that will lead on to a wound. So depending upon what exactly is the causative factor for the generation of the wound, these wounds can be divided into number 1 clean wound and the contaminated or traumatic wound. So clean wound are basically the wound which are caused by a surgeon for a surgery. So like for a hernia, breast surgery. So these are the clean wounds. But the wounds which are present when we perform a surgery, suppose gut perforation, typhoid perforation, gangrenous hernia, strangulated hernia. So all these cases when the wound is present, these wounds become contaminated by the infected fluid that is released from the perforation or from the strangulated hernia. So let's dive into mind map. So it is a traumatic and the surgical wound. So, as I have discussed that these surgical wounds are mainly the clean wounds. So, when these wounds are clean, so what we do, we just do the surgery like this is the wound. We just close it and approximate and apply the sutures. So, now see, is there any gap between the two tissue? So if it is a deep, we apply 2 layers or 3 layers of suture, one here and one is the skin. So our main purpose, it should not be like that. We have closed the skin and below the skin there is a cavity into which the blood can accumulate. And this serous fluid and with blood is a good culture medium. If infection occurs, ultimately this will lead on to the pus formation and the disruption of the wound. That means like this. Ultimately pus has to come out. So first initially it will give rise to all the symptoms of inflammation, maybe septicemia, and ultimately if we do not look into the wound, do not remove the sutures, what will happen? The skin become very weak, thin, and it will open up with the release of the pus. So we should not let that kind of thing to occur. So these, when there is very little space, there is no space, clean wound, no infection, sharp edges, these wounds generally heal by primary intention. So phase 1, phase 2 and phase 3. So any healing of the wound takes place into 3 stages, 1, 2 and 3. Phase 1 or stage 1, simply all the features of inflammation will be there. Redness, heat, loss of function, increased temperature, all these things will be there. So this is the early phase and it lasts for 0 to 3 or sometimes up to 5 days. So what exactly this phase is? All the features of inflammation is there. So when we approximate the wound, platelets, they accumulate at the site of injury or the wound, and then fibrinous material is deposited and the wound edges adhere by the adhesions produced by the fibrinous material, and the strength to the wound is given only by the suture. These adhesions cannot give strength. If there is no suturing, then it will with slight movement it will open up like this. So after 3 days to 3 weeks, what happens? All the space that is left inside the wound will be filled with granulation tissue. So what exactly happens in the wound? There is migration of the lymphocytes, migration of the phagocytes, monocytes, fibroblasts, and regeneration of the capillaries from the margins. And ultimately all these cellular elements, they cause the generation of matrix, collagen. Along with that, they also cause formation of the plug. And ultimately all these make a fresh red tissue that is known as the granulation tissue. So that granulation tissue fills the gap between the two edges of the wound. If the wound is healing by primary intention, that means whole of the space is closed. There is no space for anything to accumulate in the dead space. So there is simple epithelialization at the margins, upper surface of the wound will take place, and the wound will heal by primary intention. So what happens in case of when the wound is produced by the trauma, road traffic accident, or other kind of crush injury? So in that case, there is large quantity of the wound become disrupted. There may be crushing of the tissue. So most of the tissue that the site of injury may be damaged, dead, with no vascular supply. There may be contamination of the wound from the outside, that is dirt, soil, everything will be there. There may be some foreign body may be present. So what happens? Granulation tissue, as we have discussed, is formed by the capillaries, various cellular elements along with the collagen. So after that, what happens? 3 weeks to 1 year. So in 3 weeks to 1 year, there is just the remodeling of the scar tissue occurs. So what does that mean is remodeling? That means if there is a scar formation, this much scar is there. Ultimately, with the contraction of the myoepithelial cells, there is contraction of the wound. If the wound was initially of this much size, ultimately it will contract, and after 1 year, 6 months to 1 year, it will remain of half the size. So this is, and there is continuously migration of the various cellular elements, mainly the fibroblast, monocytes, and there is continuous turnover of the collagen fibers depending upon the stress produced over the scar tissue. So strength of the wound is also very much dependent upon the quality of the collagen fiber being deposited. So poor is the quality of our proteins that we are consuming, poor will be quality of the collagen that is produced by the fibroblast. So at the end of the 1 year, so what exactly is the strength of the wound? It is almost 70 to 75% of the original strength of the tissue before any trauma or the incision. That means scar tissue is always weaker than the normal healthy tissue. So this is the various phases of the wound, how the wound heals. First is the phase of inflammation, then granulation, and then is the modeling and remodeling of the scar tissue. So what happens in the suture? We have already discussed suture. There is a thin film of granulation because there is almost no space, and the healing occurs very rapidly without any ugly scar. There will be thin line except in cases where there is tendency of hyper scar formation, hypertrophic scar, or beyond hypertrophic scar there is formation of keloids. So that should not occur. So if some patient has this kind of tendency, we must advise the patient to wear, after the removal of sutures, wear the pressure garment to decrease the formation of hypertrophic scar or the keloid formation. So what exactly happens? Just a minute. Fold the note. Now comes the traumatic wound. As I have already discussed, it becomes dirty. There is lot of dead tissue. So both acts as a culture. Dead tissue as well as serous fluid acts as a culture medium for the bacteria which has already gone into the wound from the outside. So that should be prevented. So how we can prevent? We have to remove the culture media for the bacteria which has already gained access into the wound. So we have to completely remove the dead devitalized tissue from the margin and the depth of the wound. First. Second, we have to wash the wound with copious amount of the saline so that any foreign particles, dust, that should be removed. And then we have to look for the margins of the wound. If they are not, you can say, oozing, so that means dead tissue is there. We have to remove the margins, from the margins, the dead tissue, so that the margins are copiously oozing with fresh blood. So this wound heals by the second intention. So what is the meaning of healing by second intention? This is the cavity that remains. This cavity contains lot of dead tissue, infected material. Along with that, there is quite a large space. So when we find that this kind of wound is there, and we have clear-cut idea that if we close this wound, it becomes infected and ultimately we have to again reopen it. So first thing is to properly inspect the wound, remove any foreign body that is present, any dust, dirt. Then look for the tissues which are hanging from the margins. Look for the margins, whether these are dead or healthy. Any dead tissue that should be removed. And wound should be lightly packed with some betadine solution after cleaning properly with hydrogen peroxide, betadine and normal saline solution. So now the wound is clean as per we can see it. So we have to inspect the wound after 24 hours, then 48 hours. So we should not close or apply suture in such kind of wound. So there is a lot of space in this wound. So what will happen? All the, you can say, serous material that will accumulate, various types of cellular elements that migrate from the body into the site of the wound, and they start the healing process. So there is regeneration of the capillaries that also migrate into the. So what happens? This wound heal from this, like slowly and slowly. Whole of the space will be filled by the granulation tissue, like this and this. And when this whole area is filled with your granulation tissue, what happens? Over the granulation tissue, these epithelium migrate like this. And then from the both ends, the epithelium migrates and meet in the center. So sometimes what happens? This granulation tissue migrate above the margins of the epithelium. So in that case, epithelium cannot migrate over the granulation tissue and then reach to the other side. So in this case, we have to facilitate the healing process. We have to remove the excess of the granulation tissue and make it that granulation should be at the level of the epithelium of the skin, so that epithelium from the margin of the wound can easily migrate over the granulation tissue and it will cause closure of the wound. So heals below upward. So as I have discussed, capillaries, fibroblasts, other cellular elements, they fill the gap, and then healing takes place from the base. Myofibroblast contract and wound becomes small. So epithelium migrates from the margins, cover the granulation tissue, and when they meet from both ends, then the migration of the epithelium stops and the final scar tissue is formed. So then starts the remodeling process that takes place throughout the year, in fact throughout the life of the patient. So that remodeling takes place depending upon the stress lines, what kind of stress is being given to the scar tissue. So wound closure. When such kind of wounds remain open and they slowly close because of the contraction, not by the epithelialization. So contraction of the wound takes place because of the myofibroblast. These are present and they produce the collagen fibers. So what happens when wound is there? The margins of the wound, they gape and dried scab is formed because of the inspissated or dried up serous fluid along with the blood. So under this scab, the migration of the tissues takes place when this reaches at the level of the epithelium. So when the epithelium from this side and this side, they migrate and the scab over is shut off from the body. So non-infected, and this usually occurs in a non-infected wound. If the wound is infected, then there are no chance of such kind of things. So non-infected epithelialization taking place from the margins and scab ultimately falls off, pushed by the epithelial layer. So in that case also, trauma and infection is also, in case of traumatic wound, road traffic accident wound, infection is also there. So these are the things that usually takes place in the healing of the wound. So there are many factors which play important role in the healing of the wound. Here comes our role. Healing otherwise takes place spontaneously on a God mode. But when such kind of wounds occur, so what we can do is we just have to facilitate or help the body to heal faster. So how we can do that? We have to find out what are the various factors that decrease the healing of the wound so that it should come up and heal faster. So that healing process should be helped out by us. So we can increase the blood supply, we can increase the nutrition to the tissue, we can remove the dead tissue, we can remove the foreign body, we can also control the blood sugar. If other systemic disease is there, we have to control that also. Chemotherapy, antibiotics, if the patient is taking and they are hindering the wound, or patient is taking the steroids, we have to stop all those things. So what are the various factors which affect the wound healing? Infection is there, foreign body, necrotic tissue, poor vascularity and the tissue tension and the edema. So whenever we have closed the wound, in case of primary intention, clean wound, surgical wound, or in case of your traumatic wound, we should always inspect the wound in the 24 hours and 48 hours and up to 72 hours. Because sometimes sutures become so tight because of the edema, and they cause the strangulation of the margins. If the wound was slightly infected, the collection is there because of the dead space that wound was not properly closed. So that will act as a culture medium along with the edema, tension, necrotic tissue. So margin becomes necrotic and ultimately wound will gape as soon as the stitches are removed, or stitches cut through and the wound will gape. So what are the various factors that delays the healing of the wound? Advanced age. Because in advanced age, intake of the protein, nutrition is decreased, deficiency of various elements are also present. Along with that, healing process and immunity of the patient is decreased. So all these cause the delayed healing and the poor scar formation. That means strength of the wound scar will be not as strong as in case of young people. Then comes the nutritional deficiencies. So nutritional deficiencies, all those elements, all those structures, protein, which are required in the deposition of the collagen, regeneration of the capillaries, all these if are not in a good amount, that means they will also cause decreased wound healing. So what are those? Vitamin C is very important in the maturation of the collagen fibers. Hyperproteinemia will give rise to poor collagen fibers, that means poor strength of the scar tissue. Zinc will also, if it is absent, zinc is also required in the maturation of the collagen fibers. If the zinc is not there or deficient, then the proper maturation of the collagen fiber will not be there and the scar will be very weak. Chronic steroid therapy will also cause a decreased wound healing, decreased migration of the fibroblast at the site of the injury. So that will also cause decreased wound healing. Diabetes mellitus, that also acts as a good culture medium in case of infected wounds, where there is collection of the serum and the collection of blood into the cavity. Over that, there is high concentration of sugar in the blood. That all adds to the good culture medium, and that also causes the delayed wound healing. Along with that, malignant diseases, if the malignant disease is present, it will cause the decreased wound healing because of the malignant disease. If the patient is having some kind of treatment, that may be your chemotherapy, radiation therapy. So all these can cause the decreased wound healing. So renal disease can also decrease the immunity and also cause hypoproteinemia, increased urea and creatinine level. They all act synergistically and they cause a decreased wound healing. So patient on chemotherapy, patient on radiotherapy. So why there is wound healing? Because this radiation penetrate deeply into the tissues and they cause the necrosis of the tissue along with your compromised vascular supply by damaging the vascular supply to the tissue. So that will lead on to poor wound healing. So all the factors which can lead on to poor wound healing, we have to look for that, and we have to either, if it is possible to remove, we have to remove, or if it is possible to decrease those factors intensity, we have to decrease the intensity. So in every way we have to facilitate the healing process of the body so that wound healing takes place in the shortest possible time. So this wound healing is very important. Sometimes it goes out of control when the wound becomes too much infected. Patient may go into septicemia, patient may go into systemic inflammatory response syndrome, ultimately ARDS, MODS, and ultimately patient may die. So we should always take care that if the wound is there at any point which are less vascular in nature, like your gluteal area, perianal area, your limbs. So wherever dirt wound is there, we should not be in a hurry to suture the wound. We should always, if we find that wound is clean, still slight doubt is there, if we want to close, we should always observe 24 to 48 hours. We can do delayed primary closure. We should not be in a hurry to close immediately. So after 24 to 48 hours, when we find that this wound is still not clean, we have to do the debridement. We may have to flush the wound and then let the wound heal by secondary intention. So if we leave the wound to heal by secondary intention, what will happen? There may be some bad scar, but it will not cause the death of the patient. I have seen one patient that went to Haridwar to have a dip in a Ganga, and he got injury just below the knee, and he went to some local practitioner. He tightly sutured the wound immediately after the injury. So patient came to us 2 to 3 days after the injury in a septicemia. Whole of the limb was swollen. When we opened the wound, there were dirty, foul-smelling fluid was coming out of the wound. And the fasciotomy was done, and what we found that whole of the compartment of the muscles of the lower limb were blackened. So we could not do anything to that patient, and that patient died. So had that wound was not closed, the patient would be alive. So we should not hurry in a closure of the dirty wound. We can wait. Ultimately, what will happen maximally? A bad scar will be there, but the patient will remain alive. Thank you very much.